Okay, so good morning. My name is Anthony, so I'm gonna perform a nasopharyngeal suctioning. So first and foremost, before we go inside a patient's room, we also have to need to check the patient's chart for any important information. Once inside, make sure we wash or sanitize our hands, and then if present with the healthcare provider and even healthcare staff, we explain it to them, including with the patient, if conscious to what's the purpose of this, such as it would help clear up their secretions, so it will aid them. And then after that, we also have to check the patient's ID band for confirmatory purposes, reassess the patient, most especially checking the vital signs such as the SpO2, heart rate, and most of all the auscultation part, listen to the breath sounds. So once everything is done, we already wash our hands, we should wear our gloves, clean gloves, and possibly we can also wear other PPE such as a gown, a face shield, and even a mask for any protection from any splashing of fluids present. So first and foremost is we have to grab a nasal trumpet. So this one is a nasal trumpet. So with this, we can also check it up by its how the length, by measuring it from the tip of the nose until the earlobes, or we can also view it with based on this the bevel, the hole on it, if it's just too small or too big. So first is we have to lubricate it with a lubricating jelly. So we have to clean it up in a clean gauze. So once done, we have to view the septum, if there are any deviated septum or there are any trauma on it, or if the patient just came from any surgery, there might be obstruction. So first is we have to insert it gently. So the lubricating jelly would help it up. If we sense any obstruction, we have to twist it gently in a circular motion until such time we reach the point where we want to do a suctioning part. So assuming there's any obstruction, we can also use a smaller size, or we can do it on the other side. So once done, we have to hyperoxygenate the patient first with a non-vibrator mask. Make sure we inflate this one. So assuming it's been inflated, we have to put it to the patient. And leave it to the patient. So after that, we have to check this one also, the suction regulator, the vacuum. We have to set the appropriate pressure of between 120 to 150, not more than that, especially for adults. Make sure we also check the suction bottle, if there are no any misconnections, if it is being secured, and then also the tubing, try to obstruct it if it's functioning, and try to check the manometer. If it's more than 150, we have to just readjust it, as long as it won't exceed negative 150. So once done, we have to prepare these other stuff over here, such as the sterile gloves, and then we have to get the lubricating jelly. With this lubricating jelly, we have to put it in this clean container, or possibly we have also another gauze where we're gonna put the lubricating jelly. And then make sure we have a sterile water, put a specific amount to this catheter to re-sterilize it. And then after that, we have to choose which one is our clean and our sterile side. So assuming my sterile side is on the right, so this one is my clean. So we have to put it where carefully the sterile gloves. And then grab it, which is my sterile area, insert it with my other hand until we sense a hissing sound directly from the catheter. And then first is we have to try to suck a adequate amount of sterile water to make sure that it's functioning. And then once you're ready, we have to lubricate it in this one, the lubricating jelly, or if there's a gauze in place. So once you're done, remove it and then carefully insert it to the patient's nose. And then when inserting this one, make sure we won't do in a circular motion like this, because it's not indicated. It might cause any trauma on it.